The promises made are coming to reality as health and medical facilities across the nation are being modernized. A system of modern climate-resilient community polyclinics are being built in various communities. The initiative was introduced to further expand the government's intent to provide easy access to health care for all sections of the community, from the most vulnerable upwards, with a fully inclusive healthcare access policy. The community of Maho will be one to benefit from the newly developed polyclinics. The new facility will have access to ambulance for urgent transfers to the main hospital when needed, and well-stocked pharmacies. To ensure quality care and high physical standards, Dominica's healthcare facilities will be smart. They will utilize integrated technologies that deliver quality care and manage information. The intent to construct a new health center in Maho was first revealed at a town hall meeting in Maho.
The structure is, again, reinforced concrete. The roof is reinforced concrete. It's hurricane-proof as far as we can make it. We have hurricane-proof windows, we have hurricane-proof doors. It will have hurricane shutters over the windows in addition as well. Again, we are subject to clear possession this week of the building. The overall construction program will take 8 months. We've considered the needs of the modern health centre. So all medical gases will be brought in through the walls into bedhead rails. There'll be no more of this having oxygen bottles, nitrous bottles in the room itself. All the bottles will be in a central store outside. Clean facility. It's going to have locking bedhead rails. It's going to have above average levels of lighting, wash basins, high-feed facilities. We're trying to make it as modern as possible in order to serve the needs for decades to come.
The total area for the polyclinic is 3,693 square feet. The ground floor plan is 2,670 square feet and the first floor 1,023 square feet. This $2 million project is expected to be completed by June 30, 2020. The new health center will house 2 clinics, male and female restrooms, ambulance emergency rooms, nurses treatment rooms, and 2 doctor rooms. It will also consist of residential quarters for medical staff. The new health center is located near the playing field in Tiza, Maho, close to the primary school. Though very accessible to all constituents, Parliamentary Representative for the Maho constituency, Honorable Rayburn Blackmore, is developing new strategies to accommodate pedestrians.
You have a situation that most of the persons who actually access these health centers on a consistent basis are the persons with pre-existing conditions. Well, most time the elderly folks, and then they might find themselves with some difficulty climbing that hill. That's always been a challenge. And these are not folks who are blessed with family members with vehicles to drive them up to the health center. So we are thinking of some alternate ways also to actually alleviate the plight of those people. And to cut that road, going back into Back Street, okay? There was a house there that was actually destroyed by Hurricane Maria. We'll be having discussion with the landowner and to actually taking the road from there into the health center and to make it easier for the people to actually commute and to transform that place with a nice parking lot, nice flowers planted.
Prime Minister Honorable Roosevelt Skerrit says the government is focused on making primary health care a paramount in the delivery of healthcare services.
Our first stop is a health center, and to ensure that primary healthcare services are accessed. And we're hoping that all people can understand that do not wait for you to get too ill before you start seeing a doctor and so forth. And make use of the health services. You're pregnant in this village, going to a private doctor is fine, but you should register yourself with the primary healthcare providers at the health center. and do your regular checkups and so on.
Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, says the Ministry of Health has bigger vision for health in Dominica and encourages citizens to take advantage of the services available.
We are also looking at the human resource because we need these structures, but we also need the human resource that we can actually have proper staff so that we can have efficient running of these facilities. So the human resource is an integral part of our whole health vision for Dominica healthcare, and the facilities as well. So it's a comprehensive approach that we have for health in Dominica. Whether it's the infrastructure and the facilities, whether it's the human resource part. So what needs to be done now is for us, the people, to take advantage of this and for us to play our part.
Chairperson of the Maho Village Council, Mrs. Agnes Benjamin, is grateful to the government of Dominica for what she described as an enhanced development for the people of Maho. Mrs. Benjamin encourages the people of Maho to appreciate this gift and make great use of this facility.
Whatever we get from whoever we get it, we should cherish it as our own. And this health center is not anything that we should vandalize. We should take care of it as our own, because anything that happens, we are the ones that are going to benefit. If we fall sick and the ambulance is not able to come for us, we can at least rest there. The nurse or whoever is there can at least take care of us before they can take us to the main hospital in Roseau. But we should not vandalize it. We should treat it as our own, because if it is gone away from us, we do not know when we can get or if we can get another one. So we should treat it as our own. So all of us, we should appreciate it as our own. The benefit is our own, because when we are not well, we can help ourselves. That's where we have to go. So we have to do our best to preserve it. If we see anybody vandalizing it, we should bring it up to the authorities and we should apprehend them.
The COVID-19 pandemic has in no way affected the works of the newly developing health centers. The government of Dominica will continue to elevate the national healthcare system to stand amongst the best in the region by focusing on the improvement of skills and training of healthcare professionals with continuous medical education and certification. The health professionals will remain empowered to perform with excellence and to provide the best care and service to Dominicans. Alia Martin for the Government Information Service.